Stop podcast surfing. You're in the right place. I've always wanted to sing. Hi, everyone. I am your host, Kimbralon B. I'm a licensed counselor, but I'm not your counselor. And I'm also the host of Good Tea and Reads. So I created Good Tea and Reads so we could use everyday topics, issues, and current events to explain the importance of mental health awareness. Most mental health discussions are so important because so many people suffer in silence or do not realize that they're dealing with mental health issues because of stigma, society, and family expectations, and other reasons. Some episodes on Good Tea and Reads are heavy and will make us think. Other episodes will be very enlightening or refreshing. But either way, you will have an awesome experience. Here's the disclaimer. Any information shared on Good Tea and Reads is not a substitute for seeking professional care from another professional. Any information shared on Good Tea and Reads is not meant to diagnose the subjects or persons discussed on this podcast. Also, any information shared on this show is for conversational, inspirational, and educational purposes as well. So, all right, this intro is long enough. All right, so go grab your cups really quick. Go, 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 go. So I can pour this piping hot tea. Meet me inside on this episode in 1, 2, 3. Hi, everybody. Welcome to another episode of Good Tea and Reads. I am your hostess with the mostest, Kimbralon B. Hey, everybody. How is it going? Just checking in. Excited to be back with you. Did you miss me? Because I missed you. But anyway, everybody, I am back. A little bit about me in case you skipped my intro. I am a licensed professional counselor, but I am not your counselor. The reason I say that is because I talk about counseling, I talk about whatever on the show. And you may be able to say, hey, that seemed like that's helpful. But there may be some parts of you that I may not know about. So I will encourage you to go and see someone that's closest to you that you can pair up with, and they can learn more about you and identify strategies and give you information that will help you in your personal journey. All right, so I'm excited about today's show. You know, I say that each and every time. If this is your first time tuning in, welcome. Okay. I like to talk about mental health because this is my passion. One thing that I realized being a counselor, unfortunately, people don't really make it to me all the time. It may be finances, it may be you don't know where to go, and it may be shame. Like, I don't know if I want to talk about whatever I'm dealing with because I'm scared that somebody would judge me. So I decided to take my show on the road, i.e., this podcast, to let you know that it's okay to not be okay. And if you're not feeling okay, you can actually pair up with a counselor or a therapist or someone like my guest today, and we'll sit down and we'll talk to you. We'll even explain the process because I know this is new. You'll watch television, you see how they show it on television. It may not work that way, but I just encourage you to come and see us. We keep your information confidential. We definitely don't judge you. Um, and the only time we may say something is if you talk about harming yourself or others, and we have to say something about that because we want to make sure that you're safe and others are safe. But we're here for you. So I just encourage you to get connected with someone. And if you want to know how to connect with someone, feel free to reach out to me, Kimbralon B, at goodtandreads@gmail.com. All right, y'all. So we're going to go ahead and get started. I know I had to say that information. We're going to jump right in, everyone, because I've been wanting to get my guest on here for a while. I got to tell you all something funny that you're tuning in. I was like, okay, we're going to record it this time today. So I sent my guest an invite, and it was an invite for 10 p.m. at night. So my guest was like, no. So we're making sure we're doing this at daytime time for you all. Okay. All right. So, any information on the show is for conversational, inspirational, and educational purposes. And again, it does not substitute you seeking care for someone else that is closest to you, and we'll give you those resources at the end of the show. So, I like to give my informal introduction of how I met my guest, and then my guest will give you the formal introduction. So, everyone, I love going to networking events. And I especially love going to networking events where there are other healthcare providers in the place. Like, this is a place where I'm like, yes, this is what we're doing. We're dealing with the same thing. You're awesome. Thank you for working with people. And then I get to learn what people are doing for the community. And so me and my guests, we clicked because we're both in the healthcare fields. My guest is a clinical social worker and I am a counselor. So when you meet, you gravitate, you have some of the best conversations. And I was sharing with my guests, yes, I am a counselor, but I'm a podcaster. I like talking about mental health. And my guest was like, oh, that sounds very interesting. And I'm like, if you're interested, can you come on? And my guest said yes, because my guest loves serving the community too. And I was like, thank you, Amy. You are the best. So, y'all, that's my introduction. But I've just given you my little heartfelt version. But, Amy, can you introduce yourself to our viewers and listeners?
Yeah, thank you so much, Kimberlon, and I couldn't agree more. We just kind of hit it off and started giggling and connecting on all kinds of things. So thank you so much for having me. Yeah, so I'm a clinical social worker. I am a mental health therapist, and I have a bachelor's degree actually in business. So I did that first. Spent years in corporate, then was a stay at home mom for several years, but eventually followed my passion and became clinical social worker. So I've been in the mental health field for about 15 years and I've had my own practice called Be Balance Counseling for 9 years. I specialize in adults 18 and older. I treat all types of conditions, but my specialty training really is in trauma, but trauma, from my perspective, is any negative experience that was overwhelming to the person at the time it happened. So that could be a variety of things. And we don't have time to go into that today, but the kind of modalities I specialize in are I'm certified in EMDR and certified in IFS. And I'm also trained in ketamine-assisted psychotherapy, which we're going to be talking about today.
Yes, I am excited to just get in and deep dive into the ketamine assisted psychotherapy. So, before we get there, Amy, viewers and listeners, let me give you the name of today's show. All right, everybody that tunes into Good Tea and Read, you know I like to find a title that has the word tea. T actually means information. So it's good information and reads as if we're talking about books and we're exploring mental health concepts from a book. So today, everyone, I actually got the T title. Okay. And I somewhat made it up. I use AI a little bit, but I put a spin on it. So the name of the show is No Cap, which that's a word they say, the young people say, Amy. Cap means no
That's
lie.
right. No cat.
No cap. And then it's yes, cap. KAP, ketamine assisted psychotherapy. And it's the reality on ketamine therapy. All right, y'all. So I had to put that out. I thought that was
Love it.
really cute. So without further ado, we're getting ready to start. Amy, you ready?
I'm ready. Let's go.
All right. So everyone that comes on Good Tea and reads, I'd love for them to give their definition of mental health. So can you give us your definition?
Yeah, of course. So when I think about mental health, I really think about mental wellness. And to me, that means being balanced in multiple dimensions. So, balanced with your emotions, your thoughts, your behaviors, and your nervous system. So, I also think about being able to adapt and respond to changing circumstances, life stressors, and be able to return back to your baseline. So, anytime we are having trouble adapting or we're adapting maladaptively, so poorly, our mental health gets out of balance. And that might be a time when we're want to seek some tools or seek some help.
Okay, perfect. I really think that is a perfect example of where we're going today, especially talking about the ketamine assisted psychotherapy. But with that being said, I know some of our viewers and listeners may not be familiar with what ketamine is. So, just to make sure that we all understand and all have the same understanding, Amy, can you let us know what is ketamine?
Yeah, of course. So ketamine is a fast acting dissociative medication. It has been used for a really long time in medical settings for sedation, pain management, and anesthesia. And so now ketamine is being used off label in therapy settings to help with a variety of mental health conditions. So it's a Schedule 3 medication, and it's the only legal psychedelic available for use in the therapeutic setting outside of clinical research or religious exemptions.
Okay, awesome. So now that we have that understanding, then my next question is going to be, what is ketamine assisted psychotherapy?
Sure. So, ketamine assisted psychotherapy is often referred to as KAP, or CAT, ketamine assisted therapy. And we use this to actually like assist us in the therapeutic process. So, the ketamine itself isn't necessarily what reduces the symptoms, it does help with depression. Directly, but it's really a catalyst for behavior change. And so we use it to help open the brain and make it more psychologically flexible, and that helps the person in therapy to learn new patterns of behavior, new ways of thinking, new neural connections form, and it helps them maybe get rid of or shift some of that stuck pattern of behavior or ruminative thought. So we use the medicine plus traditional psychotherapy in combination to basically get people better faster.
Awesome. I've heard about ketamine, how it is so effective with depression. So that is so good to hear that people can actually benefit from that and therapy, because we know that plus therapy improve those chances of people's symptoms actually going away. Earlier you mentioned trauma and you mentioned other specialties, which I know you have a ton of them because you listed it on your beautiful website. But what inspired you personally and professionally to specialize in ketamine assisted psychotherapy?
Yeah, it's a little bit of a story. So, I grew up in the 80s, and so that was a big say no to drugs time. And so I was like, oh, no drugs, no drugs. And I didn't really see it as medicine at first, but clients kept coming into my office and asking about ketamine, asking about other psychedelics. And I thought, this is cutting edge and this is where we're going with mental health. I better get educated. And so I started just kind of poking around, reading things, started talking to people, listening to podcasts, and I really just started educating myself, and I was like, wow, this is really fascinating. And so then I had a therapist friend, or I have a therapist friend, and she was way ahead of the game than me. So I started picking her brain and she started sharing more and more. And then I went to a conference, the IFS conference, which IFS is one of the therapies that I do that works very well with ketamine. And I went to a ketamine assisted therapy and IFS workshop there. Dick Schwartz is the creator of IFS, and he led this training. And then when I started to learn about the benefits, I was like, this is really amazing. And I have so many clients that they're making progress, but gosh, I would like to help them faster. So I teamed up with a psychiatric nurse practitioner who was also already familiar with the KAP process. And so we started doing teamwork together. And I started working with the low dose and then later the mid dose. And I know we'll get into that later. But then I also believe that, I need to walk the walk and talk the talk. That's kind of my philosophy as a therapist. So I'm not going to ask my clients to do anything that I haven't already done myself. So I was like, well, I need to try ketamine myself. And there's always stuff for people to work on. And so I did ketamine and I did ketamine assisted therapy. And it was really remarkable the depths to where that medicine can take you. I had done plenty of therapy in my life, but I don't mind sharing this. I've had pretty long history of medical trauma. And even though IFS and EMDR were very effective in helping me heal from that, there were still little pieces that I just could sense they were in there and I couldn't get to it. And using the ketamine as the assist, I was able to get to some deeper places and I feel so much better. And so I was like, I really need to make this a part of my practice. And, once you experience it, you get it.
Nice. Thank you for actually sharing that with us. I know we said we'll talk a little bit more about that, but with that part of the training, I just want listeners and viewers to know that it's not just textbook. Amy did share that you actually, during the training, will go through that experience
Mhm.
yourself. So that should bring some comfort to knowing that this is something that's safe to do and actually comfortable to do. And we'll talk about the settings and the support that you get later. Thanks for sharing that, Amy.
Yeah, that's a great point. If you don't mind if I just jump
Yes,
in,
please.
is I'm really glad you brought that up. So yeah, when you go through your formal training, the therapist actually experiences exactly what the client is going to experience. So yeah, just know that as long as your therapist is trained properly, that they have had that experience themselves so that they know what it's like for you and they know the vulnerability about it too.
Thank you so much. So, besides depression, because I know we mentioned that earlier, what other mental health diagnosis does ketamine help with?
Mhm. Yeah. So a quick note on depression is it's actually a really fast acting boost for depression, and it specifically helps with treatment resistant depression. So for your viewers and your listeners that maybe feel like they've tried everything for depression, this is something maybe that you want to be open to. So other conditions are anxiety, OCD, um, substance use disorder, eating disorder, bipolar disorder, as long as you're not in active mania, acute suicide ideation. And there's some promising results with postpartum depression and adjustment disorders. So it really covers a lot of conditions and a lot of symptoms.
It does. Wow. I didn't even know that. It covers a wide array of
Mhm.
symptoms. So that's pretty awesome to hear. So I have some more questions for you, Amy.
Keep them coming. Let's
Why
do it.
would someone use ketamine with therapy and not just therapy by itself?
Yeah. So you're kind of talking about like who maybe would be a good candidate for this.
Yeah.
Um, I would say a couple different things. So somebody who's been in therapy, well, first I will say is for the person who feels that they've tried it all,
Okay.
and they think like there's nothing else I can do. I've tried it all. I've tried meds. I've tried all these different types of therapy. I've tried different therapists. I've tried some of the other techniques and modalities that are out there. That would definitely be somebody that I would encourage them to try this. So there is hope. There's something for everybody. Do not give up. So another person might be just they've been in therapy. I see this a lot. Maybe they have complex trauma and there's just a lot of layers. and we're making progress, but it is taking a long time. Like I'm talking 1, 2, 3 years. And it's hard to stay in therapy that long, right? And it gets expensive. And so somebody who wants to maybe get better faster or there's a lot of complexity. It also might be somebody who it has a lot of what we call protective parts. So maybe other people might call them defense mechanisms. And so they're having a hard time accessing the more vulnerable aspects of them, like and we can't really get to the root of the problem. And it could be somebody that's very intellectual too. And so they want to analyze everything.
Mhm.
And analysis and insight is really helpful, but it's actually not going to create lasting change. So that would be a good candidate. And then somebody maybe that knows there's just deeper material in there, like a like I had with, I have had a lot of surgeries and I just sensed there was something in there. And sure enough, I found it.
Thanks for sharing that because I can see, especially the part where you shared about the defense mechanisms, because it
Mhm,
is sometimes hard for us to open up, as we mentioned before. And we see that in therapy all the time. Of course, trust can be a factor. It may just be trust from not knowing that person or trust that's related to trauma and all of that. But it's hard letting go of something. That's why it's important to do what you need to do in therapy, because even though that it's something that's like deep inside of you per se, and we're talking about trust, you typically can't share that information with your loved ones,
mhm,
right? And we're talking about trust.
mhm.
So sometimes it takes an outside party that you can open up with. But again, if there's that little bit of you're hesitant, ketamine will definitely help you. And I'm glad you mentioned about overanalyzing, because I have to share this with you, Amy, and with the viewers and the listeners. I'm somebody that over analyzes. Like if there was, I'm dealing with this. Why am I dealing with this? They want me to look at this strategy. How do I know that this strategy is going to work? You do all of that. And this is me doing this, everybody. I'm a counselor. Of course, it's not going to work if I'm up here thinking about all of that. So you may need that additional support to just relax and be able to let some of that go.
Well, and
Uh,
can I jump in real quick? Like
Please.
I really love what you said about trust. And so even if you have an amazing therapist, amazing counselor, and you do have that trusting relationship, sometimes our nervous system just has a memory that holds on. And even though they're like, I don't understand, I really trust you, like I feel safe in this relationship, and I just can't access it. So ketamine works as that has that dissociative effect and takes you to a little bit different state of consciousness. So different material can come up. So trust is absolutely can be a challenging for many people, but even when we do have trust, sometimes the body remembers, the nervous system remembers, and we need a little assist again from the
Yes.
medicine.
Yes. Thank you for sharing that, Amy. All right. So I know you mentioned about being from the 80s. We say no to drugs, right? Because I grew up during that time too. The commercials back then, they was priceless. Like,
Yes.
oh my gosh, I could just go down this rabbit hole with them, because I mean, if you thought about touching anything or smoking a cigarette, we're not judging here, everybody who's listening. So if you smoke, that's not what I'm talking about. I was just talking about like the commercials that would come on. You would be like, uh, watching television. So is ketamine a drug?
Oh, I guess if you mean it like a street drug, is that what you're I mean,
Yes.
it's a medicine.
Okay.
It
Yeah, because
it
that's
can
some people may say, all right, we're talking about that, and we've been hearing about psychedelics, because you know how sometimes the definition of psychedelics can be a little different
Mhm,
outside of the therapy realm.
right.
So that's one question I wanted to ask you. But will someone become addicted on ketamine?
Well, so first I wanna, like, just kinda reiterate, yes, it is a medicine, and we're using
Okay.
the medicine to assist clients in their healing. And it's actually has a really great safety profile already using it in like the medical setting. And so it's safe to use in the therapy setting. And one thing that makes it so safe is that we use low doses. The environment in which the client is in is controlled and they are being monitored throughout the process. There's some vitals that are being checked, and I'm with them through their entire journey. So, first, I just want to comment on that. And then, an addiction risk when people hear about ketamine being used on the street as a party drug, that's in much, much higher doses. It's not controlled. So, it's used completely differently. And in the clinical trials, what they have found is that using it in these lower doses therapeutically, they haven't seen patients wanting to seek ketamine use outside of the therapy session. So they're not developing a tolerance and needing more and more and more and wanting to use it, outside of therapy session. And so the addiction risk is low.
Okay. And the reason I'm asking, because I know people Google, I know about media, and I remember, a few years ago, I'm
Mhm.
saying years, I forgot when, how long ago, that media reports had mentioned about Matthew Perry
Mhm.
overdosing from ketamine use.
Yeah.
And I know some people may think, well, if I decide to do this therapy or if I decide to take ketamine, will I overdose?
Yeah. Um, so I can't speak, you know, to a lot of obviously I don't know the specifics of his case. I mean, I saw what's in the news as well, but what I can tell you from what I saw is he was being prescribed high doses for at home use. He was self-administering or had somebody administering to him that was not a doctor and was not in a controlled environment. I believe he also went into a hot tub, which is not going to be great if you're on a dissociative medication. The doses that we use are very low. There's a medical evaluation that you go through before. And after 3 visits, you meet again with the medical provider to talk about dosing and how things are going for you. So it really is a monitored approach.
I know you mentioned a medical evaluation.
Mhm.
So if I was interested in ketamine assisted psychotherapy, would I have to go to my doctor for a physical, or do you complete the medical evaluations? Like, can I just come see you or do I need to go see my doctor?
Yeah. So good question. Is no, I am not a licensed medical professional, so I can't evaluate you, but I have trusted partners in the medical community, nurse practitioners, medical doctors, naturopathic doctors that I collaborate with. And so, after meeting with me for the initial intake to discuss what you want to accomplish, and we assess if ketamine is right for you, then I will refer you to one of my collaborative medical doctors, and there will be a very thorough medical evaluation going over your health history, any conditions that you have, medications that you have. And so that is the person who will clear you medically. And then that is the person that will prescribe for you. And then
Oh,
you come back to me. So you're with me through the entire process except for that medical evaluation. And, if there's some reason they need you to go back to your primary care doctor, that will be coordinated with that medical um, person that I work with. But no, you don't have to go to your own physician.
okay, perfect. So with that being said, I know, like I know you mentioned about ketamine being like a street drug and then there's a way to properly administer it. Since it's so much like mixed information out in the world, because definitely when they come see you, they'll receive the information that they need and they'll also have like the material to support it. But are there any stigmas or myths associated with ketamine use or a ketamine assisted psychotherapy that you heard of? or your clients may even share?
Yeah. I'll be honest, like the people that I'm around and the people that come to me, they've already educated themselves, and so they are there because they want to heal. So I don't hear it like directly in that setting, but I think things out in the community, what goes on is addiction risk, or it's just somebody who wants to get high. It's a quick fix. It's not really gonna get to what you really need for long-term healing. It's kind of woo-woo, that's just for the spiritual hippy-dippy people. Um, and I love spiritual hippy-dippy people, by the way. I'm just saying that so you asked about stigmas, right? Um, and I think there's some questions about long-term of effectiveness. And if you're not doing the integration, which we'll talk about here shortly, it's not going to be long term, but when done properly, there will be long term relief.
Okay, perfect. Is ketamine assisted psychotherapy a standalone treatment, or is that a broader plan, including like therapy and lifestyle changes?
Yeah, it's definitely a part of a broader plan. I think it can be, I have to be careful here, like can be a standalone treatment if the person is highly, highly motivated and is able to do their own work beyond what the protocol is. And we'll again talk about that in a minute. But I do see it as it's something to do to help people get better faster, but you have to make changes in your life on your own, which as a therapist, that's part of the integration and part of what I coach you through. But if you don't make those changes in your life and follow through with the integration, I hate to say it, you might end up back to where you started again.
Mhm. Yeah, definitely. So definitely you have to just stick with the plan all the way through. I'm glad that you shared that because some of the stigmas that people talk about is that being a quick fix. It may move at a quicker pace for some people, but again, that depends on you and your situation. And so
Mhm.
Amy's just providing us like this broad overview of what the process looks like. You would have to go talk with someone that's closest to you. And if you hear, go meet with Amy, but you'll have to pair up with somebody to figure out and identify that specific plan for yourself.
Yeah. Do you mind if I speak a little bit more on that?
Yes, please.
Um, You know, if somebody is following what the research and the clinical trials support, integration should absolutely be a part of it. And they should, if you're working like with a therapist and a medical provider, like I do at my practice, the therapist helps develop that plan. Some people, there are a lot of clinics out there, medical clinics, where you can go for IV or a shot intramuscular IM. And what you want to be cautious about looking for is clinics that don't coordinate with a therapist or an integration coach. They don't even talk about it. They just tell you to come in, you do your shot, you do your IV, and you go on your way because that is out there. It's not
Yeah.
regulated. And, I was at the same networking event you and I were at. I was explaining to somebody, and the person said, I tried it and there was no integration, and it was a really missed opportunity. And the sadness I saw on this person's face really broke my heart because consumers don't know that. And so it really is up to the medical professionals to guide them. But so I do want your viewers and your listeners to know to really be mindful of seeing what is offered. If somebody is just giving you the medicine and sending you back on your way, that's not what the research supports, and that's not where the real healing happens.
Thank you so much for sharing that because that's very important. And it's unfortunate because
Mhm.
you got to do your research. If you don't know, connect with somebody that does know, like someone that's a healthcare professional, but do your research, please. So, Amy, how does ketamine assisted psychotherapy benefit mental health? I know you've been sharing with us, but is there anything else you would like to share?
Yeah, so something that's really important to note is what ketamine does in the brain is it makes it more open and more what we call neuroplastic. That's a term that people are becoming more and more familiar with, meaning that the brain can change. So new insights and can form and new neural connections can happen. And so there's a window in which that can happen. It can help people shift out of like that ruminative looping thinking. It can help them with motivation. It can help them have a more positive outlook on life. It can release stored emotions and trauma. It can give people more hope. And a lot of times you'll also see like people feel like more connected to themselves. Like there's just an inner trust and more connected to their inner wisdom. Some people feel more connected to something bigger than themselves. But there is I really want to let's like pay attention to that neuroplastic window. So then the first 24 to 72 hours after a ketamine session, that's where there's an opportunity for some really good change. And that's why you have to do the integration, which might look like journaling or breath work or changing habits, getting off screen time, things like that.
Okay. All right. So I know I've been talking about mental health. I love to talk about mental health, but I got to ask you, Amy, with ketamine assisted psychotherapy, will it help with physical health issues too?
Well, there is a pain protocol. That's not an area for me, but I know that if you work with doctors who are specialized in that, there is a pain protocol for working with ketamine. I will say what what ketamine assisted psychotherapy can help with, it can change your relationship with your pain. And that is so powerful. And I've had personal experience with that.
Thank you for sharing that. Because I was also thinking when I even gave you that question, like if your mental health improve and those symptoms subside, it should help with your overall physical health.
Mhm.
You
Yeah,
make
I mean,
sure. Go ahead.
what we know is moving our bodies, connecting with people, getting out into nature. Those are all really important and they help with our mental health. They help calm our nervous system. And so if you start to just feel more connected to yourself, more connected to nature or something else, and have a little bit more inner trust and and more motivation and positive outlook, then you might be more likely to connect with other people, go for a walk, get into nature, exercise. So I mean, they're you can't separate them. They're very interconnected.
Okay, perfect. All right. So I was very impressed with your website. I am. I probably mentioned that earlier because I went to visit your website because I encourage viewers and listeners to do their research. I like to do my research too to just see. And I'll have your information at the end in the episode description so they can visit your website as well. But can you please tell us how you developed the model?
Yeah. So in all fairness, the model is following the model that came out of clinical trials. And so what I was trained on, and then I customized it to my practice. So what the research supports is 6 consecutive sessions of the ketamine medicine session with integration sessions in between. And so those can be done over, once a week or 2 times a week, 3 times a week. So sometimes you'll see the 2 times, 3 times a week in a clinical setting. For me, I do it once a week for 6 weeks because I find that the relationship is really important and we need time to metabolize in between. So, you want me to go through the process of like what it,
Yeah, can you also walk us through the model?
yeah, yeah, yeah. So, if somebody's curious about it, first of all, they can give me a call and I offer free phone consultations. They'll be brief, but we'll kind of answer some questions and help the person decide if they want to pursue this as a healing journey. And so then they'll schedule what we call an intake evaluation with me, which is pretty standard in the therapy process. So they'll come in for that first appointment. It's called an intake. We'll go over symptoms, goals, expectations, what they are dealing with and what they want to get out of it. So, and that's really a get to know each other also and make sure that there is good rapport and the person can feel safe in working with me because safety is absolutely number one and trust and rapport. And so then that's when I'll send them to for the medical evaluation. And so that is separate and the fees are associated with that provider. And as long as they're cleared there, they'll come back to me for preparation and intention setting. So with preparation, we're looking at things setting, body set, and intention. So you'll hear this in the kind of psychedelic or ketamine spaces, set and setting. So set is about their mindset on the day that they come to their medicine session. And making sure that they've given themselves time to relax before coming. They're not flying in from work or dropping the kids off or something like that. So it's what do they bring into the medicine session? What is the emotional state that they're in? So we'll talk about that. We'll also talk about any fears or expectations, hopes, or beliefs that they have about their experience. And then the setting is we'll go over that. I'll show them the room. In my practice, I have a separate room and there's a nice, comfy, low level massage table that they'll be in. There's dim lighting, really relaxing music. There'll be an eye shade and a blanket. And then there's curated music that plays during their medicine session. And then there's what we call body set, which is the physiology. So you really want to, in the days leading up to your experience and during that entire 6 session experience, you're going to want to make sure you're really optimizing your sleep, focusing on some good nutrition, simplify the diet, do some at least gentle moving. And then the day of, you have to fast for 4 hours. And we just encourage people to hydrate a lot before, but then with whole liquids just leading up. So there's no need to use the bathroom during the session. And then you limit the caffeine that day. And then intention setting. So the intention is really important. This is kind of like a compass or something that sets the direction for the medicine session. Okay. So we think about what does the person want to invite in or what do they want to release? It serves as a guide during their journey or during their medicine session. And so, even though we set an intention, I encourage people to have a beginner's mind and really be open to like whatever happens during the session. So, there is a saying um, in this space is you may not always get what you want, but you will always get what you need. So, be open to that. And when we set the intention, like I said, we're in what do we want to invite in or release? So we're setting an intention using words like, I want to allow XYZ. I want to accept this part of myself. I want to let go of not feeling good enough. So that's kind of what it is about intention setting. So that's appointment number 2 with me. And then we will do the medicine session. And the medicine session lasts anywhere between 2 to 2.5 hours. And during that process, we do a different type of preparation. So I use oral, I don't think we talked about, it's called an oral troche. So it's a lozenge and you put it under your tongue or between your cheek and your gum, and it just dissolves and you swish it around. It takes about 15 minutes for that to take effect. So we're doing a meditation during that experience. And then they're just being in their experience. I'm there to help them with anything that it might be difficult for them. They just, so they know that somebody is always there to support them. And then when they come out of that, we do non-directed integration. So I'm more listening to their experiences and maybe asking them some furthering questions. And then after that, we'll meet within that 24 to 72-hour window. I don't know if you remember, I mentioned that's the window of opportunity where the brain is the most changeable. And so we'll meet again virtually or in person to make meaning out of their experience. And that might have been a little bit more than you were asking. I think you asked about
Oh,
how did I develop the model, and I walked you through the entire process.
oh, that was the best. I appreciate it. I'm sure the viewers and listeners appreciate it. So thank you for sharing that and walking us through that experience.
Yeah.
Because
And I just
really,
wanna
oh,
oh,
go ahead.
sorry. So, if we have time, do I have time to just share a little bit about a
Yes,
different method?
please.
Okay. Okay. So that experience is what we call like the mid dose and more of that psychedelic, highly dissociative state. There is another way that I do it at my practice that a lot of practitioners don't do, and this just comes from my training in IFS, and it's called low dose or psycholytic dose KAP. And this is where you're actually verbal during the process. So the process that I just described, you're nonverbal during that. And we process after when the medicine has worn off. With the psycholytic dose, this is where I'm actually doing the therapy simultaneously while they're under a small dose of ketamine. And so usually I use IFS, which stands for Internal Family Systems. Your viewers can look that up at the IFS Institute website. And it marries really well with this low dose. And so I'm guiding people through healing um, wounded parts of themselves. And so they're both wonderful treatments, but very different experiences.
Thank you so much for even sharing that. I was really impressed, like, even you walking us through that experience, because I think about like the stigmas, or some people may be uncertain if this is something I want to do. And walking through that, that shows how you're there every step of the way. And it helps people feel at ease because they
Yeah.
know what the experience is going to look like up front. So thank you for taking time out to share that.
Yeah, and one last thing I'll mention, because I failed to mention, was after the third visit of that mid dose, you'll go back to your medical prescriber and do a check in, just like a 30-minute check in. And that's where you have an opportunity to say how the dosing is going for you, if you're having any adverse reactions, and your provider will adjust the dosings. Typically, you go up in your dose every session, but that there's a halfway point check in. So that's
Yeah.
you're being monitored the whole time for safety.
Yeah, so thank you for throwing that in as well. So y'all see, somebody's there with you and it benefits you, and it definitely helps if you have some of those. I call them stubborn symptoms,
Yeah.
stubborn thoughts, the stubborn whatever that doesn't want to go away. So I did mention your website, but I want to give you an opportunity, Amy, for those people that are here in Arizona, can, or maybe even beyond. Can you tell us about your business? How to book appointments, and do you do virtual services? And please mention your website information.
Yeah. So the name of my practice is called Be Balanced Counseling, and it's just bebalancedcounseling.com. And my Instagram is Be Balanced with Amy if you want to check that out. I just try to offer some little tips, helpful tips. And my practice is in Tempe, Arizona. I do in person sessions and virtual. I am only licensed in the state of Arizona, though. So that means that clients have to be in the state of Arizona in order for me to see them per my license. And so, what you ask about booking an appointment? I think,
Yes,
yes.
booking.
Yeah. So booking an appointment, all the information's on my website, but you can email me, you can text me, you can call me. We'll always do a quick chat on the phone so you can get to know me a little bit. I find that really helps people bring their guard down and feel a little bit more comfortable before moving forward, because it's a big step to do this. And so the mid dose ketamine sessions, which is the bulk of what we talked about today, those require you to be in person with me. Once I get to know you, if you want to do the psycholytic dosing virtually, as long as I've decided that I'm comfortable with that and the medical prescriber is that we can do virtually, because it's just such a smaller dose. But in addition to the CAP, I treat anxiety, depression, trauma, relationship issues, life transition, you name it. Like I said, I was in corporate. I was a stay-at-home mom. I'm a working mom. I'm an empty nester. I've covered a lot of ground in my life. So there's something for everybody.
Amy has you covered. One-stop
I
shop,
Amy has you
everyone.
covered. Yeah, I
You'll
love it.
actually see everything Amy does on the website. It's just right there. And it's even little videos too. I was like watching your website, like completely.
Thank you.
So, Amy, if someone is watching the podcast or listening to the podcast and they stay outside of Arizona, do you have any resources or website to get them connected to someone nearest them?
Yeah, definitely. I do have to reference my notes so I get it correct.
That's okay.
Okay, the first is ASKP3. So that stands for American Society of Ketamine Physicians, Psychotherapists, and Practitioners. So that offers education, safety guidelines, policy updates, and a national provider directory. So that's great for people all over the United States. There's the ketamine task force, so you can Google that. MAPS is a great resource. MAPS stands for Multidisciplinary Association for Psychedelic Studies. You can learn all about ketamine and all about other psychedelic medicines. And then clinicaltrials.gov if you really want to get into the weeds.
All right, perfect. I'm glad that you shared that because, again, I know that we hit Google, and I'm glad that you gave those websites so people could actually do their research, look at the clinical trials, and find somebody nearest them. So I encourage you, if you're wanting to do some research, I'll have these web links in the chat so you can check them out and make sure that you're getting accurate information, everyone. Well, Amy, we made it to the end, and this was like so informative. Like my knowledge in ketamine assisted psychotherapy was real narrow. I really didn't know that much about it. And even you sharing that, I feel like I know a little more. So thank you for coming here. So before we end, did you have any last words for everyone?
Yeah, I just really want to thank you for giving me this opportunity to share this type of work. It really is cutting edge, and I think it can help a lot of people. And so, thank you first of all for bringing it to the public. I think what I want to just say, this is in general, just coming from a therapist, regardless of the modality, is I know it's hard to reach out. I always tell my clients making that first phone call or inquiry or sending that first email is the hardest part. And that's true for all of us. As
Mm,
true for me as
me too.
well. And yeah, and I just want you to know, like, there's a friendly person on the other end of that email or the other end of that text or the other end of that phone. And you can interview your therapist, you can shop around, like, and I encourage you to do that is um you won't regret it. So
Yeah.
I just want to encourage people, take your mental health seriously. It's a lot of stress out in our environment these days, and you don't have to do it alone. You really don't.
No, we're here.
Yeah.
We are here. And it's funny that you shared that, Amy, because on some of my other episodes, I tell people if you don't feel that connection with your therapist, like, of course, do it more than once. I
Yeah.
will say that. But if you don't feel that connection, I always say that you can fire your therapist
Mhm, mhm.
and find someone else. But if they are challenging you and it's appropriately a challenging you, because remember the trauma, the shame, and everything else will be like, don't share. You'll hear when they're asking you questions, don't do it, don't do it. It feels like it's an internal struggle. But if it's that kind of challenging, I encourage you to kind of challenge yourself. Again, think about feeling comfortable. But if they're coming from a good place, be willing to take that step. Sometimes it is really, really hard.
Yeah,
So
I always tell people good therapy should be mildly uncomfortable. You know, it
it should be, you
yeah,
know?
yeah,
But
but it should be done with care and
yes,
kindness. But we're trying to get to the root of the problem, at least in my practice. I wanna get to the root of the problem so that you feel better for the long run, not just the hour that you're with me.
perfect. Thank you, Amy. Everyone, it's been another great episode in the books. I know I say it every time because it's true. So, everyone, take care of yourself. Go check Amy's website out. Share with everybody. Let everybody know that Amy's here. If you're somewhere else, please get connected with somebody nearest you to see if ketamine assisted psychotherapy will benefit you in your situation. So I am getting ready to sign off now. Do something fun for self-care or something relaxing. This is Kimbralon B. See you next time. Bye.